the third one.
Okay, and I just unmuted myself, so I think we're okay on that. My pleasure to introduce Stacia Graber. She represents Oregon House District 35, and that's composed of Tigard, South Portland, South Beaverton. She was elected in November 2020, assumed office in January 2021, which meant that she ran her first campaign and got elected and did her first full, session in Salem, all in the midst of a pandemic, which I think is pretty incredible right there. She's off to a strong start, though. She is Vice Chair of Business and Labor Committee, member of Ways and Means Committee on Public Safety, Veterans and Emergency Management Committee as well, and she's on the House Wildfire Recovery Committee. And these are all appointments that she has a particular expertise in, because besides being a representative, she's a firefighter and a paramedic, and her background is in Homeland Security and Emergency Management. She's currently a member of the Tualatin Valley Fire and Rescue. She's a proud member of the International Association of Firefighters 1660 and very active with her union. She serves on the chair of the Equity and Inclusion Committee, and she's done some pretty good things as far as reaching out for attracting and retaining women in the firefighting area. In Salem, she played a crucial role in securing a passage of a wildfire initiative that is going to bring millions of dollars, something $200 million, to bolster firefighting and mitigation. And after last year, I think we're all very aware of the devastation that wildfires can cause. So, and on top of all that, she's a mom. She and her husband have 4 teenagers at home. So I'll just let the 4 teenagers idea kind of sink in. And I'll move on to Rachel. Also, my very great pleasure to welcome her. Rachel represents House District 37, and that touches both Clackamas and Washington counties. Her communities include Lake Oswego, West Lynn, Tualatin, Durham, King City, River Grove, and Stafford area. She was elected in 2018, and I understand that was not an easy election. She took a seat from a Republican incumbent who had been in for quite a few years. Re-elected in 2020 with nicer margins at that point based on her record and all the things that she had accomplished. She's now Assistant Majority Leader in the House. She's on the Economic Recovery and Prosperity Committee. She took that position with the start of her second term. She's also chair of the House Health Care Committee. I think she'd been vice chair before and now is chair. And vice chair of the House Committee on the COVID-19 response. She's also a chair for the Access to Primary Care. It's a work group that is trying to come up with policies that will make quality health care affordable, quality health care available to all. So clearly her colleagues depend upon her for health care things happening, and that fits exactly with her background. She has bachelor's and master's degree in nursing and more than 20 years of experience in her profession. Most of that as a family nurse practitioner, and her specialty is serving chronically ill or homebound patients, providing primary care as well as palliative or hospice care. So this is up close nursing, and she gets to actually know people and see their struggles and know that there are people who are rationing their medications because they want to make them last longer because, the high cost of medications. So, just in a position to see how important all these issues related to healthcare are. And she says that actually she views everything, public policy, through a public health lens, but that includes, a lot of territory too. It's building healthy and safe communities. So a lot of work to do, of course, and I think we're all glad that Rachel is there in Salem to get it done. Okay, and I'll turn things over now to Randa, and I will mute myself.
Thank you. I'm going to I didn't do the homework that she did, so I'm not saying as much about Courtney as Marge did. But it is my great pleasure to introduce our third panelist, Courtney Neuron. She's a member of Tigard Branch, and she's a prior student of another member, Linda Toledo, which I'm surprised Linda's not here. She was a teacher, Courtney was 26, I'm sorry. As an educator and mother of school-aged children, She has particular interest in education policies and funding, access to affordable health care, and protecting our environment. Courtney serves on the House Education Committee, House Committee on Early Childhood, and the House Committee on Housing. Courtney will be facilitating today's discussion, leaving time for questions at the end. Thank you, Courtney, and it's all yours.
Thank you, everyone. It's wonderful to be here with you all. Thanks, Randa, for that introduction. Yes, I am Courtney Neron. I do represent House District 26. As we heard, that is the Wilsonville, Sherwood, King City, Bull Mountain, unincorporated Washington County out to Hillsborough. Oh, I'm seeing myself. I'm going to hide that. Today, we are joined by two of my incredible neighboring colleagues to the east, Rachel Prusak in House District 37, and Dacia Graber in House District 35. And it's been an incredible experience to serve with both of them and to really learn this process as someone who didn't have a political background with incredible leaders such as themselves. So we are all thrilled to be here with you all and excited to answer your questions. We're going to leave it fairly casual. The three of us are ready to talk about redistricting, our priorities. We've been asked to recap the recent legislative session. So we've just had our long session in 2021 and then a special session for redistricting. So we'll recap the redistricting special session as well as some of our focuses as legislators. And then at the end, we'll think about and share some of our thoughts on being women in leadership and what that has meant to the state and our own experiences. So to start off, I'd like to just kind of kick it to Rachel and then Dacia to introduce themselves, and then I will also discuss just a few bills about the legislative session, our focuses, and then give a little preview of the upcoming session. So we'll spend just about 10 or 15 minutes kind of going over some of the areas that we are representing in the State House. And let's go first to Rachel, who is on call today throughout this meeting. So we'll make sure that we're flexible. And then to Dacia. Rachel, go ahead and share. And we're so glad to be here with you all.
Thank you, Courtney. Can you all hear me? I know there was a mute control thing. Great. So I don't think I have to give an introduction because Marge, you gave an amazing introduction, and I kind of think you should intro everyone everywhere because it makes us sound way better and cooler than I think we are. So thank you. The only correction I would make is I actually recently stepped down from leadership. So I'm not the assistant majority leader anymore. But given the topic that we are talking about, I make a joke that when I stepped down, 3 political positions take the 1 political position during session, because coming up next will be a lot of campaigns. And so 3 men stepped up to run and take the position. So I make a joke that it took 3 men to take my 1 spot. And then I'm not chair of the Universal Access to Primary Care Committee anymore because I closed that committee, and out of that committee came some policy. Some passed in this recent session and some I'm still fighting for. So I figured I'll kick off talking about those things. So as mentioned, when I'm not in the legislature, I am a primary care provider. I'm a family nurse practitioner. And yes, I am on call. So we take call for the entire practice every 3 months, which is covering 1,500 patients. I care for a really complex homebound individuals. So if I do jump off, it's just because I got a call and I will jump back on. But the bill that passed that is huge and a priority for me was access to telehealth. And this was a big part of the discussion during that work group. And it was a bill that I tried to pass pre-pandemic. And at that time, there was a lot of opposition. Nobody felt like there should be pay parity for telehealth. Insurance companies and others would describe it as a lesser service. And then, of course, the pandemic hit, and my one silver lining is it really showed how access to telehealth improves care, and not just for physical health care, but more importantly, mental health care. And so House Bill 2508 passed with a huge coalition of clinicians and clinics and providers and patient advocates. And it really is the model legislation for telehealth. I was just in DC for a Medicaid leadership conference, and there were other states that had passed telehealth legislation, but I fought really hard to not have a sunset on it. And it really is the legislation that other states are looking to. So hopefully all of you on this call have been able to utilize telehealth. And I will add one funny story to this. I established with a primary care provider and then had a follow-up, because many of us neglect our own health when we're in session, and after it we feel pretty beat up and we need to get back on track. So I had 2 virtual visits scheduled, and for both of them, I drove to the clinic because I thought they were in person. And I just kept laughing with my doctor that I created and passed the legislation for telehealth, and then I don't even know how to utilize it. Another bill that I'm really proud of that I passed with the help of the 2 women legislators that are on this call today through healthcare. And as mentioned, I try to use a public health lens on everything, and really fought for our safe storage, safe homes legislation to come through healthcare this year instead of judiciary, which is the first time ever. And we were able to pass that bill, and it is now law as a few weeks ago. And hopefully by encouraging everyone to lock up their guns and safely store them, we will save lives. And one other highlight, since I was asked to highlight 3 that I am really excited to share with everyone, is we passed a bill that creates a prescription drug affordability board. And so this was a big fight against pharma. And what this will is establish a board to spend 100% of their time to review prices for prescription drugs. And it will consist of 5 members and 3 alternatives who will serve a term of 4 years. And they have been tasked to come back to the legislature with reports, and then we can build on policy from that of what Oregon has done and hasn't done, and what we really need to do to make sure medications are accessible. And then Courtney, did you want us to talk now about future legislation, the 2 in the short session, or wait till later?
Yeah, let's just do the legislative clump right here with some of our priorities, give kind of that window into what we're working on for future, and then we'll switch into more of a redistricting focus after we've talked about each of our own priorities.
Sounds great, thanks. So continuing the work of that universal access to primary care, committee that I formed and chaired is a bill that didn't pass. And it is my priority legislation for February. It is called Universal Access to Primary Care and Behavioral Health Care. And it has 3 big things that it's going to do. I don't know why it didn't pass this last session, given it didn't have opposition, except for the fact that we covered and we passed huge healthcare legislation to address the pandemic and to make sure we passed bills like Cover All People, which expands Medicaid to adults that, if it wasn't for their documentation status, qualify for Medicaid. So we did huge things. And so I think it just kind of fell down on the priority list. And I was fighting for so many things that did have some opposition that this just didn't come up to the top. But it is my priority bill for February. And what it does is say that those that want to access their behavioral health care and their primary care in the same day can. Right now, there's a lot of rules with insurance companies that they only reimburse for one. So that's a barrier to care for those with transportation issues or childcare to have to come back to the clinic for another appointment just because of your payer. So payers will have to reimburse for both on the same day. And the cost share for primary care, 3 of primary care visits won't have a cost share. And what we know is that even just a $10 or $20 copay for many community members keeps them from going. And what that does is not only worsen their condition, whether it's diabetes or hypertension, but it's much more costly to the system. And then the third thing it does is ensure that everybody has an assignment to a primary care provider. A lot of times people don't choose one, and then so they end up having to use urgent care. So within 90 days, if somebody hasn't chosen one themselves, there will be one assigned, but of course they can change that at any point. So really removing barriers and access to primary care and behavioral health care. And then the second one will be continuing to remove barriers to Narcan and naloxone. We've done a lot in Oregon to make sure that we can access opioid reversing meds that save lives, heroin reversing meds that save lives. But right now, starting in January, every insurance company will have to cover a type, but still not everybody's getting it prescribed depending on who their prescriber is. So this really works with the pharmacist to make sure those that have certain level of morphine, which we call MME of 50 of any opioids, will have an opportunity to be offered naloxone. And I will stop going on and on about healthcare, even though I could go on and on for hours, and kick it over to Dacia.
Thank you so much, Rachel. And I'm going to pick up the mantle and actually continue to go on and on about healthcare, because let's be honest, everything comes back to public health. Everything, especially right now. Marge, I hope you're available for hire, by the way, because like Rachel said, that introduction was fabulous and I have a campaign to run. So thank you so much for that really, really wonderful intro. When I stepped up to run for office, I had no idea that shortly after, right before the election, I would be going into the field in historic wildfires, that I would be starting campaigning in a pandemic, and that not only would everything change in how we campaigned and what my priorities were, but that and my field of work, I would be donning a hazmat suit to go into calls. So lots of changes. And I've always had this personal core value of resilience, and that really put it to the test. And I was so proud to come into the legislature in 2021 with that and really accomplish a lot as a freshman. I want to echo one of my priority bills. One of the things that brought me to politics was gun violence prevention. In my work for over 20 years as a firefighter and paramedic, I have seen far too much death with gun violence. I've been an advocate and an activist with Moms Demand for, it's going on a decade now, sadly. And to be part of this, to be one of the chief sponsors of this and part of the coalition that finally got this really incredible bill across the line that I think will save more lives than we have any idea, was just transformative. That was probably for me the most powerful moment on the floor to speak to my experiences in that. So incredibly proud of that. Two other kind of coalition bills that were, again, a really tremendous group effort that I want to focus on as well. One was Senate Bill 762, and that was the wildfire bill. This is something 13 years in the making. We have known that we have these issues, and it is an incredibly difficult, surprisingly partisan subject, because it talks about how we use land and how we manage our forests and how we write our building codes and how we respond to these fires. And so when Speaker Kotek asked if I would be brought in as part of this work group, it was a tremendous honor, because I have decades of experience in the field in this. And there were times when it seemed like we weren't going to get that done, but we were able to get it across the line. I remember sitting masked in a locker room with Rep. Owens, and he and I have very different views on how this should all move forward. And yet we walked out of there with a solution that was able to be adopted by everyone, along with Rep. Marsh. So she was an incredible leader in that, and Senate Bill 762 passed. We can touch on it later, but long story short, that immediately freed up $125 million and the ability to pre-position resources across the state in this wildfire season. So as difficult as things were, as big as the burns were, and as much as the terrible air quality affected folks, especially east of the mountains, we were able to prevent some of these historic blazes from turning into the same kind of destruction we saw in 2020. Also, Mother Nature cooperated and we didn't have those east winds. So that's a big part of it as well. Another coalition bill that was years in the making that I was so fortunate to step in with, particularly with Rep. Evans from Independence in Monmouth, was House Bill 2927, which kind of a weird thing to think about, but it decoupled the Office of Emergency Management and the Oregon State Fire Marshal's office from the military department and from OSP. So what that does seems like a small thing. It is an 87-page bill if anybody ever needs a little light reading before they go to bed at night, but that's going to give the ability to have these agencies be standalone and be flexible and nimble and able to respond better, not just in wildfires and a pandemic, but one of my favorite things to talk about that no one likes to hear about is this little earthquake that we are kind of at risk of. So please let me know. I love to talk earthquakes. And then just a couple bills that I personally got to work on. It was a really incredible experience coming into session to work with Tigard Mayor Jason Snyder. We talked about the need for police accountability and reform. And the two of us worked on writing a bill for basically anatomy and physiology training for our police officers. So when they're using routine holds on folks, to understand what that means. We're both paramedics. We both saw like, here's an opportunity to both better train our police and create accountability and a system that looks out for folks that are in custody. Part of that bill also is a duty to act. So if an officer is restraining someone they go into some level of cardiac or respiratory compromise, they have 60 seconds to call 911 to activate EMS. And that was a bill that we worked with the sheriffs and the police officers as well. So it was a real collaborative effort. And then finally, I was able to take a priority of Rep. Doherty's, who she was incredible to work with, the PrEP and PEP bill, and that is to increase access for life-saving HIV preventative medication and make that available through a pharmacist. So I could talk about all these bills. I'm so excited. This has been such an incredible session, and I'm really looking forward to what's coming. For the short session, just to keep it short and sweet, I will be staying mostly within the workers' compensation space. It may shock you to realize that we actually have, I should back up a sec. We have an incredible cancer presumption bill in Oregon. It was one of the first for firefighters. So the job I do carries a high risk of cancer. We've been through this as a family with my husband and his throat cancer. It seems to particularly affect for both men and women the reproductive tract. So if you are a man in Oregon and you are a firefighter and you get testicular or some sort of reproductive cancer, you're covered. If you're a woman and we're trying to increase access to firefighting for women, if your cancer happens to fall anywhere below your breasts, you are not covered. So that seems to be a pretty obvious gap. I'm hoping we can change that. There is opposition to it, but I am determined, and watch out, because when I'm determined, I get it done. And then there is one other bill in the workers' compensation space for fairness in workers' compensation claims and disputes. We're still working out the details on that. So happy to talk about it more, but for now, in the interest of time, I want to kick it over to Rep. Neron, to Courtney. Thank you.
Thanks so much. And I hope everybody can see just how wonderful it is to work with these two incredible women. For my recap and preview, I want to just highlight and echo and amplify some of the work that they've brought up as well. Our focus on healthcare during the pandemic and serving all Oregonians has been a focus for our legislature, as well as addressing gun violence and safety. And that is definitely one of those things, as Rep. Graber mentioned, that also was part of my motivation for leaving the classroom, frankly, after the Parkland shooting, really wanting our schools to be safer spaces and our communities to be safer places as well. So to recap some things that really were part of my focus in the recent legislative session, I've worked hard to ensure that our children in foster care have a court-appointed special advocate. And so we increased funding for the volunteers and for the programming that can support helping a child navigate our legal system when they really have no stable adult otherwise in their life to help them navigate a very confusing place. And I also worked hard on the Toxics Free Kids Act to ensure that the products marketed to children are safe for those children to engage with. And that was actually bipartisan and passed out of the House. It did die in the Senate. So I will be bringing that back likely in 2023 with an emphasis as well on maternity products and nursing products as well. So making sure that and feeding products, making sure that our children have access to safe, toxic-free childhoods. I also worked hard to ensure that children in our schools have access to free school meals, and passed a bill to ensure that the School Safety Task Force continues with an all hazards emphasis. It originated with an emphasis on gun safety and suicide prevention, but we do have so many hazards that we believe the task force needs to be taking on, not the least of which is that earthquake, the Cascadia quake that Rep. Graber brought up. I also was a huge part of the employment-related daycare reforms that went into our child care bill. And that bill sets up a new department of early learning and care so that we have more continuity across our work in the state for early childhood. And again, to come back to the focus of this meeting and being with you all, having women in leadership can really help us emphasize some of the issues and the legislation that needs to be brought forward that really more heavily impacts the women in our communities. In addition, I was successful in passing a pesticide opt-out bill. So now if you're in an HOA, you can opt out of the chemicals that the landscapers want to spray on your garden. And we had issues with that in my neighborhood where people were having to go get doctor's notes to prove that they couldn't have the sprays on their flowers. So now it's just an opt-out ability. And as an educator, I taught French and Spanish in our local high schools. Education is huge for me, addressing educational equity, making sure we have pathways to diverse teachers and educational leadership that's emphasizing equity improvements. So that's a huge focus of my own. And so going forward, I want to emphasize that I'll be working on changes that brought me to the legislature, and that is education funding from pre-K to 20, right? We want to make sure we have the cradle to career education system. And one of the first pieces that I really want to do is stabilizing and formalizing how we calculate the current service level, because currently that's a very volatile conversation when we know what current service level is with real numbers. And so we don't really need to be speculating and kind of allowing for what happened in the last two long sessions that I've been a part of, where there's an argument about how much does it actually cost to turn the lights on, heat the schools, pay for the teaching staff. Those are very real numbers. And so I want to formalize that calculation so that we don't have a repeat of what happened last session, where the governor's office was proposing that education in Oregon K-12 needed 8.9 billion, but the Quality Education Model and Commission declared that it needed 9.8 billion. We ended up funding it at 9.3 billion. But part of that, a huge part of that, was the unstable calculation of the current service level. I also want to make sure that we're leaning in on issues such as Albany and Newburgh have been facing, where the leadership and training and protections for stable leadership are in place. So we need to make sure that we understand the connection between stable educational leadership and educational outcomes and creating safe spaces. So we'll be talking a lot about how our school boards need training, how our superintendents should not be fired for no cause, for example, and how we can hold our public servants to a higher ethics standard, expanding our ethics commission potentially. Also focused on gender responsiveness in our Department of Corrections and how our Department of Corrections re-traumatizes and increases trauma in our adults in custody who are experiencing who have experienced trauma in the past and then walk into a system that is not always nailing it when looking at trauma-informed practices. So those are some of the policies I'll be leaning into, but I have about 10 more that I'm delegated to other colleagues, and I'm working closely with them on relative to environmental issues and educational issues and local issues, such as our Aurora Airport and our Willamette River protections that are needed. So with that, I want to kind of transition into what's happening with redistricting. We've also been asked today to talk about the redistricting process, what you all can expect from the new lines in your communities. We can talk a bit about our new districts and our new lines, because each of us has some changes to highlight in our districts, but also the bigger picture for Oregon. What does it mean? How did it go for us? Quite frankly, it was very volatile in the legislature this past late September special session that the governor called, where we were successful in passing all three maps, not only the House maps, the Senate maps, but also the congressional maps, as we did just gain, based on the census data, a new seat to send to Washington, DC. And Rachel, we will make sure that you get to check in when you're back. So let us know in the chat when you're back online. So to think about the process, I'll just highlight that during the long session from January to June, our redistricting committees continued to really learn about how to redistrict fairly, how to look at communities of common interest. They heard testimony, they learned about where people commute, for example, and really looked at some of the details across the state of Oregon relative to our geographic connections, transportation connections, and communities of common interest. Once that census data was released, and it was released a little bit late due to COVID and the challenges there. Once that census data was released, efforts began in earnest to really calculate what needed to happen in our districts. So we, the redistricting committee chair, Andrea Salinas, who is or was a member of this organization, was really intentional about her effort at a collaborative approach with not only the House Republicans, but also the Senate Democrats and Senate Republicans, these four main caucuses that meet in the legislative process, and the colleagues within that committee. Unfortunately, the collaborative process broke down in the House. So there were two House maps, one offered by Senate or House Democrats and one offered by House Republicans. And then a joint Senate map came out as well. So that those were the first maps for consideration released on September 3rd. Once we had that special session, we really didn't know what was going to happen. As many of you who probably tracked it sensed that there was a potential for it to break down, as the our Republican colleagues were unsatisfied, to say the least, at what we presented. The view of fair maps is very controversial, and was recently in a conversation with somebody who highlighted that there are as many ways to draw a map as there are stars in the sky. Where people started was vastly different. So, for example, one of the values that the maps that ultimately were adopted began with was, where has the population grown? Why do we have that 6th congressional district? And focusing on those areas of growth as the reason for that special, or that 6th district and that additional position that we are able to have. So really, especially focusing on the new growth areas. And there is a conversation swirling, you probably heard about on most media sources, about the number of districts that touch Portland. And I'll emphasize that one of the districts only has a very small part of Portland in it, an unincorporated part of Washington County, that then the 6th congressional district then from there in the Raleigh Hills area moves out to our rural counties of Yamhill County and Polk County. And really it comes down to a math game of how do we parse apart our state in a way that makes sense from the constitutional requirements of being contiguous, of equal population, utilizing existing geographic and political boundaries, not dividing our communities of interest, and being connected by transportation links. So those are some of the main conversations around how those lines were ultimately drawn. So I think what I want to do is now take a moment to each highlight our new districts and line changes. I'll start and then we'll go to Rep. Graber, and then hopefully Rachel will be back with us. So Rep. Prusik can review the changes in House District 37, but House District 26 got smaller. It was one of the fastest growing districts in the state. So it used to go, or it continues to, but the new lines proposed are to take it from Wilsonville to Hillsborough and shrink that to be Wilsonville, Sherwood, King City, Bull Mountain, and Tigard areas there. So because we grew so much in those areas, we actually have enough people in that space to, as the math works out, to be its own House district. And so one of the main changes for the people in the district that I represent is actually going to be our Senate district. Our Senate district used to be a district that went south to Kaiser, St. Paul, and a lot of the rural farmland in the Willamette Valley along I-5. And now that Senate district is no longer going to be attached, or that House district that is nestled into the Senate district. Our House District 26 is now going to be joined with the newly formed House District north of Senate District, House District 26, and it will be joined with Tigard instead. So now our Senate district will be these outer Southwest suburban communities, the smaller cities of the Southwest metro area. And so that's a very different political dynamic, a very different geographical dynamic. Strangely enough, the new Senate district is actually smaller than geographically than the House district that I currently represent, but it has fewer communities in it. And one of the goals is having the entire community districted into the same space, in the same district. So those are some of the highlights that I want to emphasize about my area. I'm gonna kick it to Rep. Graber, if you'll tell us, and Rep. Graber's district, as we'll hear, changed significantly. So tell us some of those districts that, those changes that impact the Tigard, Lake Oswego area and the new area that you've been drawing.
Absolutely. So I took my role very seriously going into redistricting to remain completely impartial. Now, of course, I have feelings about this because I love representing Tigard. I love my district. But when the initial maps rolled out, I heard so much from constituents like, we do not want to see Tigard split into 4 pieces. And I put forward, I can't advocate for anything, but you can advocate for what you want. So I was so proud to see Tigard turn out en masse. There were so many folks that signed up to testify. And as a result, Tigard will remain whole at going into these new maps. So it will become the new House District 25. Now, the part that I am sad about is that I don't live in the new House District 25, which is okay. I actually am still, I live perched between Tigard and Portland in this beautiful neighborhood. I live in the Ash Creek neighborhood of Southwest Portland, and I really feel like I get to flow between Portland and Tigard. And in some ways, this is the best of both worlds. This is the best case scenario because I think it is so important as Tigard grows that it retains that whole voice. So again, House District 25 is essentially Tigard. It does not go into Lake Oswego. It does brush into Metzger. My new district, where I will be the incumbent, is going to be House District 28. And that is going to go from the northern Tigard line, also going to brush part of Metzger, unincorporated Washington County with Garden Home and Raleigh Hills and West Slope, all the way up to Highway 26. So I'm going to have those neighborhoods, including OHSU, which unfortunately I am well too acquainted with over the last few years in my husband's cancer journey. And then it dips down to PSU. So I won't have downtown Portland, but I will have these really kind of incredibly hilly, as my campaign team was like, oh boy, we're gonna get our steps in. I love it. I love it. So I will have Southwest Portland, but I will continue. One thing I've emphasized to folks, I am proudly the 35 rep right up until the day that those maps change. And I will be standing up for Tigard and continuing to do that advocacy work. And whoever the new rep for Tigard is, lots of excitement there. I will not be going away. I'm excited to work with them as well. So those were the changes, but I was proud of the process. I was proud to see people's voices centered and to see Tigard made whole. And I do think my personal editorializing, that new Senate district is really exciting because Tigard, Tualatin, Wilsonville, Sherwood, that really is the growth center of the Southwest corridor, and seeing that made whole as well, I think is just a tremendous opportunity. So it looks like Rep. Prusak is still on call, Courtney. She's still working with a patient. So
Yeah, okay.
we can take questions if you are. I'm not sure what you want to do next.
Yeah, well, first I also want to gush about the Tigard area as well. And I love the way that Rep. Graber has represented Tigard. And as somebody who grew up in Metzger and who went to Tigard High School and then taught at Tigard High School, I feel very protective of it. And I have just really appreciated how much Rep. Graber has leaned in and just loved on that community and listened to them and empowered them, as she mentioned, to really have that voice in the legislature. So let's see, we can go to questions. I do think that when Rep. Prusak jumps back on, we should listen to her review of the new lines in her area. But I see, Mary Pat, that you have a few questions, and then maybe what we can do, I'm not sure I can see everybody, is do hands raised. If I can go to gallery view. Oh yeah. And then we can, Mary Pat, do you want to kick us off with a question, and then we can focus on the things that you want to focus on for redistricting or anything else, and then we'll close with some thoughts about being women in leadership as requested.
Thank you. Thank you all so much. This is really interesting. I thought I knew what had happened in the last session, but this was a great insight into a lot of things I wasn't aware of. I actually have a question for each of you. Obviously, I'll wait for Rachel to come back for hers, but for you, I wanted to ask you, when you started talking about redistricting, you talked about the original point of view or the starting point for the Democrats. And I'm just curious to know what the starting point was for the Republicans. And if I may, just in the question I'd like to put to Darcy is, who opposes? She said there's a lot of opposition to this bill, potential bill to provide insurance for the female firefighters with reproductive cancers. Who would oppose that? But anyway, to you on the redistricting.
Thanks for that question. You know, I actually am not sure that I can answer where the Republican maps began and what their emphasis was. But as I watched all of the committee hearings on redistricting, I did hear a call for not parsing apart county lines. So I do believe that there was an extra effort in their maps to keep counties as whole as possible. But I actually, maybe Rep. Graber, if you know the answer to that, I don't know where they began. I just know that the emphasis was from the Democratic maps was trying to honor where the growth areas were as the starting point. And then as we have seen in our own efforts to draw maps and throughout this process, when you change one thing somewhere, it changes everything in other places as well. So that balancing is constant. And there's probably no way to really get it perfect according to every Oregonian, but that best effort was made to really honor those individuals that have given us that 6th congressional seat and the existing political boundary lines. Rep. Graber, do you have anything to add to that?
I do not, as much as I would like to say I can jump into the mind of my Republican colleagues on some things. We have a lot of great communications about it. On this one, I was not part of the redistricting committee, so I wasn't privy to any of those conversations.
Thanks. And then I see that Rachel Prusak is back. And so we're so glad you're back. Rachel, we just went through a little recap of the changes in our district lines. So if you want to take a moment to highlight what District 37 is and what it will be if these maps are to pass any legal challenges.
Sure, thank you. Sorry about that, everyone. And then when I jump back on, I did hear the question about wanting Dacia to talk about opposition, and I'm looking forward to her answering that. So I will say that my district, House District 37, the district I represent, changed very little. It changed less than most districts. And I'd say as at the time assistant majority leader, one of the things that I did was check in on people that I know were having an emotional response to their district changing, because I think one of the things that got missed at the beginning of this was really that was going to happen, right? We knock doors, we help solve issues, we work with our cities, our counties, our school boards, we get really involved in communities and neighborhoods, and it changes, right? And it's just something that happens every 10 years, but for a lot of people, it was emotional because of those things I just listed. For my district, there are very little changes along where King City is, because up until now, the three of us represented areas of King City. And one of the things that redistricting does is try to keep communities of interest together. So I will miss knocking on connecting with my neighbors in the mobile parks that were also my patients in King City, but I think a lot of that is now in Rep Naron's district. And then one other area line that changed is I also have patients in Mary Woods, and that area of Lake Oswego kind of it went into current Rep Salinas's area, and then an area of Lake Oswego, Lake Ridge joined mine. So very little in House District 37 changes, very little lines in King City and Lake Oswego. And I believe you asked a question as I jumped back on about where Republicans wanted to start from. And I'd say the only thing that I heard that stuck with me is, you know, the starting of the district starts with where maps are now and where growth happened and how to be representative of those areas. And despite the fact that it was a bipartisan committee 10 years ago, the Republicans wanted to start fresh, not start with what was currently there. That is one of the things I remembered hearing. And I think that was probably the biggest disagreement over how and where they were going to start. And I think we should kick it back over to you, Daisy, to answer who is opposed to that bill. But I have a feeling, maybe I'm wrong, but as the chair of healthcare, I go up against insurance companies all the time. So tell me who's opposed to that?
Ding, ding, ding. It would be the insurance companies. So insurance companies and also some of the special districts that manage the fire departments. And unfortunately, we know, the preliminary statistics, and there are not that many women in fire, unfortunately, but there are 1 in 4 of women in the fire service are going to have some sort of cancer by the end of their lifespans. And we are seeing more and more that those are job related. So cancer treatment is incredibly expensive. Prevention is the key, but the treatment is expensive, especially when you get into things like ovarian cancer, which tend to be metastatic. So that's what we're up against. We're up against not a large data subset, which makes things a little more difficult. But I am confident that we can take what we know already, what we can project in the future, and the science that exists, and get this across the line. It is hard to realize that there are folks that are opposing that, but I am ready to take that on.
Thanks so much for that. I want to just highlight that in the chat, I've dropped 2 links to, one goes straight to the maps. And you can kind of play around with the settings, and you'll want to find the setting that shows approved maps in order to see the specific lines that we're talking about. And then the other link is, I know that Representative Salinas was not able to be here, but has spoken about this topic many times. And so there's a link to her interview with Dave Miller, and you can kind of get a sense for the way that the process went. He also interviews Republican leader Shelley Bossart Davis at the same time. And so you can kind of see how their conversations went. Mary Pat has another question for Rep. Prusak. And oh, I see that there's a hand up as well. I see Sharon, and I'm not able to see everybody. Okay, and I didn't see who went first. Let's go with Sharon's question and then Mary Pat's question. And Sharon, you are muted.
Yes.
Thanks.
Okay. Can you hear me now? Okay. I'm the public policy chair for the Lake Oswego branch. So one of the things that I really wanted to get a sense of from all of you who are here, AAUW advocates for women, especially in education. Do you folks have ideas about where our best efforts could be to assist all women reach personal and career goals?
That is a wonderful question. I'm going to really briefly say that this is something I want to spend a lot of time on. But that I think that one of our main things that we can do is ensure affordable access, not only to the education, but the barriers that women face in getting an education. And we know, for example, that parents are some of our most motivated students. So in our community colleges, we know that parents really try to complete a program, advance a career, and yet one of the number one reasons why people don't complete that program is lack of affordable childcare, lack of access to childcare. So that's one of those reasons why childcare was such a big focus of mine, is I want to make sure that we look at childcare like we look at roads, as infrastructure that's necessary to get people to where they want to go. And so childcare is a big one for me, but in general, the affordability factor is also something that I want to make sure that we're addressing at higher education levels as well. And I'll let Rep. Graber and Prusak respond if they have more to add to that.
Thank you. I'll just jump in and say, Rep. Neron hit the nail on the head. That and making sure that we have job pathways. Of course, my focus is non-traditional careers, but having good green jobs, apprenticeships, things that, we are transforming our economy in so many ways that are going to provide further economic, racial, social, environmental justice. And I think that having women lead that movement is first and foremost. So any way we continue to uplift women. Also, shameless plug, elect more women. When you have women in leadership positions, women center women, and when women are centered, everyone wins. And I'll drop it at that. I do have to jump off right at 11. I just wanted to let folks know that in case I disappear for another call, but thank you for that great question, Sharon. Rachel, I'm sure you get something wonderful.
Yeah, I'll just add in real quickly that, so coming from a profession that is mostly women and watching a profession struggle, and right now having a workforce issue, and so I'm leading a work group on this, is yes, childcare is an issue. Yes, access to affordable education is an issue. And really looking at how most of the caregivers in our long-term care are women, and long-term care has forever treated this as an industry and not a profession. And so one of the things we're really looking at and talking about is how that caregiver role, who's always been women, is respected more. And so I'd say pay attention to what we're going to do around nursing workforce and supporting caregivers and support for childcare. And then lastly, on the plug of electing more women, the three of us have watched Speaker Tina Kotek, who's running for governor, fight for all of the things we're talking about here. And I'm really looking forward to not only having another woman governor, but our first lesbian governor, and one that has fought for the decade with us for things like childcare, access to healthcare, the firefighters, and I'll stop there.
Thank you so much. And we have the question from Mary Pat as well. Go ahead, Mary Pat.
Yeah, thank you very much. This is for Representative Prusak, who is, by the way, my representative. You referred to this board for prescription drugs, and perhaps I just missed it, but I'm curious to know exactly what its terms of reference are, how much power it has, and so forth. If you can speak a little more about that.
Yeah, so you can look up the specifics. It's Senate Bill 844. But this was a huge fight. Big Pharma was attacking me on the Oregonian, as well as if you searched Oregon legislature as opposed to going to the website because you had it bookmarked, before you could get to the website, it would tell you to write to me and tell me that I'm stifling research and how we got our great vaccine. Somehow I would have impacted that. But what we did that was a little different than the model legislation that was done in Maryland, which I happened to be at a national conference and learned about. And then in my freshman year, it was the only bill I tried to pass. And of course, it's a huge lift. And I really just more learned the who's, the how's, the what's when I tried to do it the first time. Instead of creating a prescription drug affordability board with the goal to set upper payment limits, meaning the state would decide what is the top price we would pay for any drug, that was the biggest piece that Pharma was against. They're against all of it, but that was the thing that's the most scary. But the way the bill was drafted, and it started in the Senate, getting into the weeds, but I really just want to touch upon this. It would have really negatively impacted some of our smaller clinics and our hospitals and smaller pharmacies. So what I did was amend it to say, we're going to set up the board and we're going to really look at what Oregon is doing, what we've already done. And so we have the transparency program already, but the transparency program is just something that is reported on and we look at. There's no action. So what the prescription drug affordability was tasked with is to say, what has the transparency bill shown us and how we can act on it. And so we invested $1 million so DCBS could invest in this board to actually tell the legislature what is needed based on the top 10 drugs that were that triggered the transparency process. And the transparency process is triggered if a medication was increased by a certain amount, really. So we'll see those top 10 drugs and look at those.
Thank you.
Yeah. And I know it's 11, but.
Yeah, it's 11. I'm curious, is 11 our end time or do we go till 11:30?
I'll jump in and answer that. We were trying to be very respectful of your time. We were asking for about an hour. I don't think there's anybody that will say, gee, I have to leave, this interesting conversation, from the listeners' end. I think it's certainly up to our reps. If you have some more time to share with us, wonderful.
I want to make sure I let Dacia Rep Graber say a few words before she goes.
Yes, thank you so much. I'm sorry, I have a thing with OLCV. I'm talking a little bit about the wildfire bill. So I have to jump over there. Just thank you so much for the time today and giving us space to kind of talk about what we're doing. I hope these are conversations that we can keep going. And there's just something magical about being in a space of other women and folks who are involved and passionate and concerned. And it keeps me going. I'm sure my colleagues would agree, the last couple of months here have been hard. It's been hard. So looking at everyone here today and knowing what we have, this momentum going forward, I just want to thank you so much for being here and giving us that space as well. So with that, I will sign off, and I really look forward to hopefully seeing you all again.
Thanks, Rep. Graber. Wonderful, amazing words.
Rep Naran, I can stay on for another 15 minutes if you want to, but no pressure.
I can as well, and I thought maybe we can take a couple more questions and then reflect on one of the other topics that they've asked us to discuss today, and just our thoughts about being women in leadership. And you just sort of offered some insight into your enthusiasm as well, but we could go a little deeper. I have a few interesting statistics that I wanted to share, but want to make sure we continue the questions about anything that we brought up or haven't brought up a little bit longer as interested. So are there other hands up or any in the chat? I don't see any. Maybe what we can do then, Rep. Prusak, is go kind of launch into our thoughts about women in leadership and in a little bit more detail. And I think that I alluded to it earlier. One of the things I want to highlight is that the focuses that each legislator brings to the work are really where the work is done, right? So when we have women in office, we talk more about childcare. We talk more about how services for victims of gun violence or sexual assault. We also, for example, passed the Menstrual Dignity Act this past session, where we will be considering access to menstruation products, essentially like we consider toilet paper, if you will. It is a hygiene product that should be available in our restrooms. And so our schools will be offering menstruation products in the restrooms at the schools. And one of the things that is really important to emphasize there from a teacher's perspective is how many students do not have access to the resources they need to have the products to be able to spend an entire day at school while menstruating. It actually will improve our access to education for women, to that earlier conversation, as low-income Oregonians will have access. There will be reliable products for individuals who would otherwise have chosen to stay home and be absent during those days. So that's huge for both education and women's issues, and just the social justice from that woman's perspective, the menstruating person's perspective, that we really are striving to emphasize. Rep. Prusak, do you have anything to add? Any other legislation that you feel like might be specifically because now in the legislature, we do have so many women serving? Anything that you're feeling is coming to mind in terms of legislation relative to conversations that women have?
I mean, I think the biggest thing is childcare right now. And I'm not a mom myself, but work with many moms and an auntie to many. And I just watch that be lifted up so much because of how many women are in the legislature. If you want to list some of those statistics, it would be maybe helpful, but I'm sure this group might already know them. And then I see that someone else has a question also.
Okay, and I'll just emphasize, we did pass a House resolution declaring racism a public health crisis. And within that is one of the main topics that I want to lean into more is the disparate outcomes for Black and Brown mothers, women who have disproportionately experienced maternal mortality issues when they are women of color. And so what we really need to do is be looking at why are these outcomes from our healthcare system impacting our Black and Brown women so disproportionately. And that is across income, across so many different factors. When we remove all other factors, it's racially we have got to make sure that we are understanding better how we need to respond to the disproportionate outcomes. Stephanie, I see you have a question.
Sorry, I had a hand up, but just physically. So.
Oh, sorry.
But really, it's going up in a. It's in a little bit different, and I think you've come to such a nice conclusion on what you were talking about. But one of the things that is happening in Oregon is changing our attitude toward drug addiction, and thinking about drug addiction as a public health thing, and maybe getting people out of jail and into homes, and a different way of approaching that. And that's a huge topic, you guys. But is there anything just initially that's going to be done that way? That because I really think it's one of the, along with childcare, and then drug addiction leads to so much childhood trauma that needs to be taken care of by that whole system supporting children. Just really interested in where maybe you're going with that.
I'd love to speak to that. So one of the
Absolutely.
things that we passed is addressing substance use disorder. And I was just trying to find a chart of how we in the healthcare world use trauma-informed language around this issue, right? Like, instead of calling somebody an addict, instead of saying failed, there's so many harms that we've done in our healthcare world for this population. And as somebody who has a brother who's been off and on heroin for years, and life has been saved by naloxone 5 times, and is now on Suboxone, had access to medication assisted treatment. So now, while is definitely, impacted from all those years of drug use, he is a father, a son, a brother, an employer, with access to Suboxone. So I've done a lot of work around access to Suboxone, access to naloxone, and I will elevate some of the work that Courtney and I have both done around Family Preservation Project, which is keeping women connected to their children while they are in prison. We know that women are in prison usually because of a crime of passion, caring for their family, and we need to change that. And so we fought really hard to ensure that program would continue. And thankfully, we're able to get that funding. And if anybody doesn't know what Family Preservation Project is, you should really look that up. They have struggled so much during this pandemic, but the more other work that we're doing is on gender responsiveness. Prisons have been created for males and not females, and this has caused more trauma. And yes, absolutely. How do we keep people out of prison? You should not be going to prison because of addiction. And hopefully with the passage of Measure 110, hopefully with the money we're investing in behavioral health, that's exactly what we do, is that we do a more upstream preventative approach. And instead of forcing parents into prison because of addiction, we support them through recovery and treating their substance use disorder that is a chronic condition that we need to treat with a public health model and not a prison model. And do you want to speak to the gender responsive work a little bit, Courtney?
Yeah, well, and I want to thank you. I want to just emphasize the importance of doing exactly what you just ended on, ensuring that we look at, and the decriminalization of addiction is so important, and that we look at addiction as a public health issue is so important to me. And then that impact on families, and Family Preservation Project, I dropped a link to their Facebook page in the chat for you to pursue. If you want to click on that later on, you can go look and just kind of learn a little bit more about the beauty of that project that really tries to reduce the trauma for the child, reduce cycles of generational incarceration and addiction, and reduce the recidivism rate by doing exactly what we need to do and wrapping around individuals that need skills, need support, and need services to to make their family lives stronger and their life skills stronger. We are looking at bringing back a bill from the 2021 session in 2022 to, unfinished business is one of the themes of short sessions, and our next session coming up in 2022, February of 2022, will be, balancing the budget, finishing unfinished business, making sure we're addressing issues that have come up that are pressing, such as our housing crisis. We still have a lot of work to do relative to the instability in housing across the state. And one of those unfinished business items is the gender responsiveness in DOC. We've had a work group going with Representative Sanchez and myself and women from the Family Preservation Project, really discussing how our system of incarcerating adults is designed with men in mind, and how we can be more responsive to gender differences is a really important part of the work that we believe needs to be done in DOC to reduce added layers of trauma that our system can layer on. So I'll be bringing that back with a few other representatives in the short session to emphasize that we can do better and therefore reduce our recidivism rates and ideally respond appropriately to the challenges in people's lives. I want to share some of the stats that I looked up, and I did a little calculation here and there. In the House of Representatives right now, during the time that Rep. Prusak and I have been in the legislature, we have now, for the first time ever, reached gender parity with the same amount of female and male representatives. And now we even have more women in the House of Representatives than men. We have 33 women serving out of 60. That's 55% representatives who are women. Of those, the 22 of the 37 Democrats are women. 60% of our Democrats are women. 47 of the Republican caucus are women. 47% of the Republican caucus are women. So 11 out of 23 of their caucus are women. These are huge successes for women. In the Senate, we actually don't have the same levels of election results. So we have 8 out of 30 senators are women in the Senate. So that's only 27%. And in the Democratic caucus, 39% are women, 7 out of 18 of them. And 10% in the Republican caucus, just 1 out of 10 are women. So, and statewide, we have all but one statewide office is women. We have Treasurer Reed is the treasurer, and he is the only male serving but in statewide office, but our governor, our labor commissioner, our secretary of state, our attorney general are all women. These are huge new stones we're turning over in terms of women in leadership in our state. Our Supreme Court is 5 women out of 7 Supreme Court justices, with the Chief Justice being Chief Justice Martha Walters. And also of note are all House leadership, top leadership roles in the House are women. In the 2021 session, we had Speaker Kotek, we had Majority Leader Smith Warner, and Minority Leader Christine Drazen. And just a side note, it's different in the Senate. All the top leadership roles were men, with President Courtney, Senator Wagner, and Senator Girard leading the Senate. So that's kind of an interesting way of, as we look at the differences in the House and Senate, there are many, and that's just one that kind of underscores some of the differences in our different chambers. Any other questions that are coming up? I haven't looked to see if there are more hands, but maybe
I want to add one more thing though, to go back to, I want to share something that's probably going to make a lot of you real mad. And I think sometimes we need that. And that is one of the bills that I started talking about and won't be able to bring back in short session because it's too big, but am working on is one that's called Mom and Baby Preservation Project. So it's really building off of the fact that in 2017, Oregon passed the Bill of Rights of Children of Incarcerated Parents. Once again, all the work done by Family Preservation Project, and really saying that children of these parents have rights. And what this bill that I want to do, it was listed as House Bill 3266 if anybody wants to look at it, although again, I knew it wasn't ready. But do you know that if you are a woman and you are pregnant and you are in prison, so you'd probably be at Coffee Creek, you have your baby in shackles, and then when you return back to prison, when you're separated from your baby immediately, you have a cavity search. So can you imagine that? So the goal is to not have so many people in prison, as mentioned. How do we treat addiction instead? But why do we do this, right? Denmark doesn't do this. And I'm looking at other countries and a few other states of, if you're pregnant, how do you have your child and have maybe a home arrest and then potentially have to serve out the arrest? And if I don't proceed with that bill, the bill that I would proceed with is making sure there is doula support during pregnancy and during the birth. And again, as we talked earlier about what opposition we're up against for something that people would think is simple, treatment of cancer for workman's comp, if you're a female firefighter, you would be surprised at the opposition to things like that. So I'd say for me, for closing, is having you all engaged as you are, which we're so thankful for. Reason why we need you is because the opposition can be loud. And so when we fight for things, we will let you know when we need your voice, when we need your help to advocate for women and moms and children and all of the things that we should be doing.
Thank you so much. I dropped a link to the Children's Bill of Rights and then realized it's the wrong one. So here's the correct link to that. Another state has it too. Here's the link to the Oregon Children's Bill of Rights for children of incarcerated parents. And I love the way you ended your remarks there, Rep. Prusak, with kind of a call to what can the AAUW help with. And that's one of the requests for comments that we have too for this session together. So yes, absolutely, reach out to our offices, make sure that you're fighting for those issues that you care about and talking with other women about our shared experiences and how to make our policies better and more responsive to the issues impacting women regardless. And it's, there's so many intersectional issues, as Rep. Graber brought up, climate justice intersects with it.
Darren, I see you waving your hand over. Very emotional.
I'm sorry, I can't see the gallery view.
All I wanted
the question. Oh, Sharon.
All I wanted to say was we do have an advocacy group in Lake Oswego, AAUW, and we do projects primarily, and we do function during the legislative session in support of particular things. So if you could put us on your email list in terms of giving us information about where you would like us to put effort or testimony or whatever, we would appreciate that, because not all of us live in your districts, but we all would respect and respond to the issues you've brought up. So is there a way we can do that?
Absolutely. There is on each of our websites, there is a place to sign up for our newsletters. we can drop into the chat or just encourage a Google search of each of us. We have, when you're searching for a representative, it's really important to look and decide if you want to look for their campaign side of their work or the official legislative side of their work. And if you're wanting to testify, you're going to want to go to their official legislative side of their work and find the official pages. So we can drop those into the chat as well. But on each of our pages, you can sign up for our newsletters, and staying in touch with us through email is always helpful. And just you saying that now, that's very helpful. And so I might invite an email to our offices, and I can drop our emails into the chat in just a moment. I might invite an email to our offices from the policy chairs for each organization, emphasizing that. So there's kind of a phone tree effect of getting information out to the various groups. And so I think that, beyond that, as I mentioned, we're each, I've got the emails ready to copy paste into the chat here. We each work in, there are two sides to our jobs really, and that is doing the job and asking for the job. There we go. And so at this point, we are turning again as representatives who have to run every 2 years. We're often on the ballots. We have to begin doing that divided work again between our legislative work and our job application. It's an extensive one. So I've put our official emails for all three of us into the chat right now. And so if you as individuals want to copy paste that into an email and send us a note, or if you as policy contact points want to drop that into an email and send us a note, please do feel free to reach out to us. And Rachel's got.
Yeah, I don't use it from the rep page because I want to be able to say whatever I want to say at any time. So I use MailChimp. And so I just put the link in for subscribe right there.
Great. And so you can sign up for Rachel's there. And then I don't have the link readily available for mine, but I can find that too and send it out to policy chairs. Also, I'm going to drop in a legislator lookup link because some of you might not quite be sure who your exact legislator is or will be based on where you live. So this link that I'm dropping into the chat is Find Your Legislator, and you just simply type your address in and it puts a little star on the map and tells you not only who your House representative is, but also who your senator and who your congressional representative is. And so that can be a really helpful link to share with anybody that's not quite sure who their specific legislator is. Also, there's an incredible tool that we refer to as OLIS. I see some head nods. It's kind of a beast. I mean, it's a really big database of information, all of the committee hearings we've ever had, all of the pieces of legislation, all of the testimony is available through OLIS, O-L-I-S. And if you type OLIS into a Google search, you'll find it, Oregon Legislative Information System. And just kind of start exploring there, or type in Oregon Legislature. Rep. Prusak, I see that you have another call, and I actually also have to get ready with an 11:30 end. Do you want to say any closing remarks?
Just thank you for having us. Thank you for all the advocacy you do. Thank you for including us in conversations, and reach out to my email and sign up for my newsletter. I get one out once a month. During COVID, it was once a week. And I would love to, I didn't even get to touch on vaccines. So next time, maybe. Take care, everyone.
Thank you so much. Yeah, vaccines is a huge topic we could probably spend an entire hour and a half on. And I know Rachel has been really in the thick of that conversation as it's come up in all of our inboxes, and people are very concerned about it. I think that with seeing, Sharon, I see your hand up. Is that from before?
No,
okay.
I'm sorry.
Just
No.
wanted to make sure. I don't see any other hands up. If there are any other final questions, I can do my best to answer. But just want to Thank you all so much for having us, for listening, for thinking through so many of the big topic areas impacting women. And you know, I'm happy as a member, I'm always at the, or often at the Tigard meetings, and happy to, you know, field any emails or calls from any of you. So I'll drop my phone number into the chat, although I think it's also in the directories. So this is my personal number. Please don't hand it out to just anybody. There we go. That you're welcome to reach out to me with the topics that you really want to dive deeper on. And thank you again for having us. Any other final thoughts before we go?
Yes, Courtney, I want to thank you and the other two for so much. This has been very, very interesting. I will put it together as a video and put it on our website, but I will let Marge know so that people can put it on their website. Lake Oswego can put it on theirs also, because I think the people who were not able to come will find this very, very interesting. And we might even find that people go back and listen to it again, because there's been so much information. Thank you very, very much.
Thank you. It's been delightful. And as Rep. Graber mentioned, it's just, it has a real kind of a battery charged feeling after being in a space with so many women and so many people who care. So thank you so much for showing up on a Saturday morning, a beautiful day. And I hope that someday we get to do this again in person.
Thank you.
Thank you.
And I'm going to sign off for my 11:30, but I really appreciate all of you, and take good care.
Bye-bye.
Thank you. I'm going to stay on and leave this open for a little while, so that if you want to go on to the chat and copy anything, you're welcome to do that. Because as soon as I close the meeting, then you won't be able to do that. And I'm going to turn off the recording right now.